Welcome, and thank you for viewing Understanding the Influenza Quality Measures. This presentation is one in a series of videos explaining the 15 quality measures that comprise the Care Compare quality measure domain of the nursing home 5-star rating system. You may find it helpful to have a copy of the current quality measures user's manual turned to either the long stay or the short stay percent of residents assessed and appropriately given the seasonal influenza vaccine quality measure page when viewing this video. The link to that manual is found on the next slide. MDS 3.0 Section O is included in this quality measure. This presentation contains information from the MDS 3.0 RAI Manual and the MDS 3.0 Quality Measure Users Manual version 14, accessed in February 2021. This presentation is meant to enhance understanding of the quality measures discussed during the presentation and is not meant to take the place of or be inclusive of all information and instructions provided by the MDS 3.0 RAI Manual and the MDS 3.0 Quality Measure Users Manual. Any updates to both of these manuals will supersede content presented, and the most current manuals should be utilized at all times. The links to the official CMS site providing MDS 3.0 and MDS 3.0 quality measures materials are provided on this slide. In the Quality Measures Users Manual, there are 4 individual long-stay quality measures that relate to influenza, as well as 4 individual short-stay quality measures. Every quality measure, or QM, has a CMS and National Quality Forum descriptor. As an example, this slide is showing the descriptors for the first long-stay QM listed in the manual, as the following 3 are additional breakdowns of this first more complete measure. These quality measures report the percent of long-stay residents assessed and appropriately given the seasonal influenza vaccine during the most recent influenza season. In the Quality Measures Users Manual, there are 4 individual long-stay quality measures and 4 individual short-stay quality measures related to influenza, as I mentioned before. We're going to be talking now about where on the MDS we get the information that populates the quality measures for the long and short stay measures. During this presentation, I will refer to the target assessment, and that is the reason for the MDS assessment. The federally required OBRA assessments are completed on admission, quarterly, annually, and with a change in status. An OBRA assessment may also be completed when making a significant correction to a prior MDS assessment. For OBRA assessments, MDS item A0310A is coded as 1, 2, 3, 4, 5, or 6. For Medicare Part A residents, the target assessment is considered for PPS assessments if it is a 5-day scheduled assessment. For PPS assessments, item A0310B is coded as a 01. Another reason for a target assessment may be a discharge assessment. The discharge assessments considered for this quality measure are those coded as 10 or 11 in item A0310F, return anticipated or return not anticipated. Each of the MDS assessments has a target date, also known as the event date of an MDS record. The first type of record is the entry record. The target date for the entry record is the date the resident entered your building. For discharge records, the target date is the date of the resident's discharge. The discharge record is coded as a resident whom you are not expecting to return, or as a resident you are anticipating to return to your facility. Deaths in the facility are also coded as a discharge record. For discharge records that are the actual date of discharge or death, this is coded at item A2000. For any assessments such as OBRA, a required admission, quarterly, annual, or significant change in status, or the PPS assessments, the target date is the assessment reference date, or sometimes called the ARD. The ARD or target date is the last day of the resident's observation period and is MDS item A2300. For example, if an item on the MDS has a 7-day look-back period, the information collected for the 7-day period will end on the ARD at midnight. For each of these target dates, you will want to make sure that you include anything that occurs on that date up until midnight. For the influenza quality measures that are long stay quality measures, these are those pertaining to residents who have been in your facility for 101 days or more by the end of the target period that we discussed in slide 5. A resident must be in your building for at least 101 days to be included in the long stay measure. A couple of points to keep in mind is that only days within the facility count in the 101 days. When calculating cumulative days in the facility, or CDIF, the day of entry counts, but the day of discharge does not. However, if a resident is admitted or readmitted on the same day as they are discharged, then the resident is considered as having a 1-day stay. For the influenza quality measures that are short stay measures, these are those pertaining to residents who have been in your facility for 100 days or less by the end of the target period that we discussed back on slide 5. A resident must be in your building for no more than 100 days to be included in the short stay measures. Again, only the days that the resident is physically within the facility count in the 100 days. When calculating cumulative days in the facility, or CDIF, the day of entry counts, but the day of discharge does not. However, if the resident is admitted or readmitted on the same day as they are discharged, then the resident is considered as having a 1-day stay. The influenza quality measure appears on Care Compare and is in the CMS data sites as a percentage, a ratio of the numerator divided by the denominator. The numerator is the actual number of residents who were impacted by the quality measure condition during the report period. So with these quality measures, the numerator is the number of residents who were assessed and appropriately given the seasonal influenza vaccine. The influenza quality, to be included in the assessed and appropriately given the seasonal influenza vaccine numerator, the resident's selected target MDS assessment must be coded with any of the following 3 criteria, shown on this and the next 2 slides. The first criteria is the resident's MDS at item O0250 is coded that the resident received this season's influenza vaccination in our facility, or they received it somewhere else outside of our facility, but the main point being that they did receive the vaccination. The second criteria is that the resident was offered the influenza vaccination, however, it was declined. Oops, one too far. Okay. The final criteria option is that the resident's MDS is coded at item O0250 as not eligible for the seasonal influenza vaccine due to a medical contraindication such as a previous allergic reaction. Any of the 3 criteria shown on slides 9, 10, or 11 will populate the QM for the resident as being assessed and appropriately given the seasonal influenza vaccine, and this is what we want to see. The denominator is the number of residents potentially impacted by the quality measure condition during the report period. These seasonal quality measures basically include all residents who have a stay at your facility with a selected influenza vaccination assessment, either as a long stay resident or a short stay resident, unless they have an exclusion, which we will look at on the next slides. Exclusions are certain conditions that will exclude a resident from being counted in the numerator and denominator. So what conditions are excluded? The CDC recommends that everyone 6 months of age or older receives the influenza vaccine unless contraindicated. For the influenza vaccination quality measure, children less than 6 months of age at the time of the assessment target date will not be included in the numerator or denominator. The Quality Measures User's Manual version 14, updated in October 2020, included this statement that the influenza quality measures are calculated only on an annual basis. Chapter 1, Section 3 and 4 of the Quality Measures User's Manual, version 14, discusses how the influenza quality measure is calculated, related to that timing. For both the short stay and long stay influenza measures, the QMs are only calculated once a year at the end of June, using the most recent MDS assessment in the past 3 months, allowing the target assessment to include the most recent influenza season, ending officially on March 31st. When coding this section of the MDS, be certain to carry forward coding that the resident was appropriately assessed and given the influenza vaccination until the next flu season begins, usually around October 1st, or when the flu shot is available in your community. The MDS 3.0 RAI manual provides examples when coding this section. The short stay and long stay percent of residents assessed and appropriately given the seasonal influenza vaccine is not provided on your CASPR report. It does appear on CMS's Care Compare site and is viewable by the public. You can view the data that CMS has pulled from the MDS reports and uses to populate Care Compare. You can also keep a log of immunization status of residents residing in your nursing home, estimating the numerator and denominator to stay on top of this QM. We've provided a link to a sample tool at the bottom of this slide. There are times of fluctuation when completing the MDS at the beginning of the influenza season, when not all residents have been assessed and appropriately given the influenza vaccine. Keep in mind that the current flu season varies across the country, and refer to the guidance offered in the MDS 3.0 RAI manual to determine the current flu season in your area. Remember that the data to calculate your QMs that appear on this Care Compare site will not be pulled out until June, so you should have plenty of time to get all the data inputted correctly. The influenza quality measures are ones that we have control over. Striving to know the vaccination status of all residents is important for the health and well-being of your entire community. Make vaccination assessment part of your admission process. Ask the resident or their family if the vaccine has been received. Request immunization records from primary care providers and transfer facilities. The HIPAA eligibility transaction system includes immunizations that have been billed, so you can ask your billing department about this resource. And finally, check your state's immunization information system website to see if a record of immunizations is available. Aim to assess and appropriately give the influenza vaccine for 100% of your residents. As I previously stated, this is a QM that nursing homes have complete control over. The QM is looking for whether the resident was assessed and appropriately given the immunization. The QM percentage will be positively impacted if the resident received the immunization in your facility or in any other facility or setting. The QM will not be negatively impacted if the resident declines a vaccination, as long as your staff has provided appropriate education and offered the individual the vaccination. If they say no, that is okay. That is their right, and that means it is appropriate. Additionally, if the resident cannot have the vaccination due to a medical contraindication, such as an allergy or a history of Guillain-Barré syndrome, that is considered appropriately and so does not negatively impact the QM. The first GP Quinn tip sheet on this list of tools provides the details that offer the acceptable responses to the influenza MDS elements, those that will not negatively impact the quality measure. We've also provided a worksheet for tracking individual resident vaccinations, as well as a tracking log for vaccinations given within your facility to stay on top of this process at the systems level. These are several resources that you can access to assist you with this when working on this quality measure. We've provided the State Operations Manual link for review of the rules and regulations related to immunizations and to be aware of what the surveyors are looking for. In addition, the CMS policy and memos can provide documentation of any changes to the regulations. Percent of residents assessed and appropriately given the influenza vaccine is a publicly reported quality measure on the CMS Care Compare website, formerly the Nursing Home Compare site. Use this website to view what consumers are seeing when they look at your nursing home and the quality measures. In addition, you can see how your nursing home compares with nursing homes in your city, region, state, and nationally. Take a look at the CDC Long-Term Care Facilities Influenza Outbreak Management webpage for current guidelines. The Great Plains Quinn QIO Nursing Home webpage provides tools and resources as well as past training events. Contact your state's Great Plains Quinn Nursing Home contact for more information or technical assistance concerning the influenza's QMs or any of the nursing home quality measures. Thank you for taking the time to learn more about the short stay and long stay percent of residents assessed and appropriately given the seasonal influenza vaccine quality measure, and for all you do improving the care and quality for your residents.